A face mask will
are
now be
testing
required
positive
across the
for the
state of
virus,
North
an average of about
Carolina
1,000 a
anytime
day
you go
over the
out
last 2
public.
weeks in North
Americans
Carolina.
lost their jobs
Even if a
just
small
in the past week. Wake Up Charlottesville.
When COVID hits in mid-March, it was pretty clear almost overnight that if we want to do business, we have to change dramatically how we provide services. Because we knew that the patients that we care for, their lives have been turned upside down as well. We got to figure out how to get our staff working and being productive, not coming into that building overnight. And our patients have never needed us more. So we have to be able to do this. We have to make this work. What we saw almost overnight, within a week after this occurred, the reports that were coming in from our case management team were staggering. There was an immediate lack of food for their families. You know, there was 3 days of food was the maximum that they and their families had. The crisis in housing, the ability to feel confident that they're going to be able to make their rent check at the end of the month. Many of the people that we serve are not documented individuals, but we believe they deserve just the same amount of care as everyone else. They were isolated before COVID. Now they're terrified to come out, and they're terrified to access not only our services, but a range of other human and social service needs. And our patients were dealing with everything in their lives. And one thing that we were not going to allow to be a barrier to care was for them to pay a penny to see us. So we immediately waived the cost to come to our clinic or be a part of Physicians Reach Out, to access anything that we did. Wasn't in our business model. No, we just did it because we knew we had to do it. We knew it was the right thing to do, even though it wasn't part of our budget. We had to become a telemedicine provider overnight. Maybe 2 weeks after the stay-at-home order, we were seeing more patients in a day, when you include the telemedicine, than we've ever done in the history of our agency, because we adapted to this technology so quickly. In the populations that we serve, we've known long before COVID that there are disparities in care. African American folks, the Latinx people, they were not receiving care at the same proportionate level we would expect everyone to receive. COVID opened the curtain to society to see many of these disparities that are very real in people's lives, but it made it much more urgent. I became really concerned about our own team and our own staff that were they'd finish helping in every way they could on the clinical and non-clinical needs of folks, and then they'd hang up the phone and the next one would be the same story. Story after story, I was worried, and still am, frankly, about the mental health and the balance that our staff has, having to adjust to this reality of a super high intensity need on every single patient that's coming to us. The senior team that really runs the agency, the pace and the rate of change that they were able to lead this agency through is it's absolutely remarkable. Make adjustments on the fly and continue to get great outcomes. I mean, this last year, which included part of COVID, our outcomes were extraordinary. I mean, we served more people, we received more money in donated care from the larger hospital systems, we grew the Nurse Family Partnership Program. We just, COVID or no COVID, we just kept going. We just kept pushing through it. And that's just a tenacity and a strength of character and a real passion for our mission and what we do. I'm proud every day of the team. You know, their commitment to do what is needed in the community. They know it's the right thing to do. They know it's the right way to go forward. And I know, I got a team of people that all embrace our mission, and they're willing to do whatever it takes. Drive food to a family, stay late and work through an issue with a family, learn an entirely new technology you've never seen before because you've got to get that mom and get her ready for the baby that's coming. It was just, it's still remarkable every day. I only wish we could do more of it.